So I think my number one piece of advice is go to adrenal.com and fill out the paperwork to become a patient of Dr. Carling's. I would say even outside of an adrenal issue, if you have a thyroid or a parathyroid problem, the hospital for endocrine surgery is the place to go. Although I didn't interact with any of the other doctors that do thyroid or parathyroid surgery, I have seen that their reviews are equally as high as Dr. Carling's. So I think, any endocrine issue you have that requires surgery, that's probably the place to go. Dr. Carling and the hospital for endocrine surgery, I think it's one of the very few things in life where the phrase "this is too good to be true" absolutely does not apply. Everything you will read on his website is true. The patient reviews, I know how quick people say the recovery is. It's all true. It's your surgery is going to be quick. It's going to be efficient. The care is exceptional. Your return to daily life happens within days. Any discomfort is managed with over-the-counter meds. And I think I'll put my public health hat on for a moment. I think the fact that you don't need to take strong opioids to manage your pain is huge. So, aside from if you're pregnant or if you have a FEO, if you're a patient that, is in recovery from substance use issues, go have a surgery where you're not going to need a Percocet or an Oxy. You can take Tylenol or ibuprofen. I think that's huge. And just an important thing to highlight that, you're not taking these strong medications to deal with your pain. And even if you're interacting with Dr. Carling, from afar, you still feel confident in your care plan, and that things are going to go well. I think the other pieces of advice I would give are, it doesn't necessarily hurt to consult with a surgeon in your area, especially if you're not local to Florida and you are going to be consulting with Dr. Carling virtually. Like I said, I think that part of the process was really beneficial to me, even though I knew going in I probably wasn't going to choose those surgeons. I still think it was helpful to have a face-to-face encounter with someone to realize what exactly I was facing. And I think my last piece of advice is, I think in my case, some of the nurses had mentioned that I was very lucky that my tumor was found pretty much immediately, once the high blood pressure was discovered. I think, there's been a lot of cases where patients deal with symptoms on and off for years and they don't have a diagnosis or misdiagnosed, and they just really struggle. So I would think as a patient, if there are things that are not adding up or you have a diagnosis and the treatment isn't doing anything, talk to your provider, ask tough questions, ask for additional labs, ask for a referral to a specialist. I mean, even if the traditional blood pressure medications I started on had lowered my blood pressure, my own plan was to still ask for a referral to endocrine, because it just seemed really weird that in a span of 2 to 3 years, I had high fasting glucose, high cholesterol, and now high blood pressure. And I refuse to accept that I was kind of the gene pool loser in the family that got all these bad genes dumped into them. I knew there was something else going on. So I think, we live in our bodies. We know when something's not right. And if things aren't adding up for you, just push your provider for additional testing or a referral to a specialist.